Hello, everyone. My name is Kori Christensen, and today I'm going to be talking to you about a diverse, vulnerable population, and that is asthmatics. Most of us probably know an asthmatic, or if not, we've definitely seen them on TV. We've heard about them, and today I want to give you a general overview into what life is like for an asthmatic, as well as what the condition is. So we look at a normal lung. The airway and the muscle that constricts it is relaxed, allowing a good amount of air to flow in and out, versus in an asthmatic lung, the airway muscle tightens, and so there's swelling in that inner lining, and overall that inflammation allows less air to move in and out of the lung, which results in the symptoms an asthmatic has. There are no specific one cause for asthma. It's better to look at it as Rothman's causal pies, considering past infections, exposure to chemicals or smoking, and genetics as factors that can altogether produce asthma. And they're going to be different for every single person. To diagnose asthma, we look for the general symptoms. When someone's brought into a doctor's office, a lot of times they'll use a spirometry test that will have you just blow out into the machine, and it will record your overall air outputs or lung capacity, and they will compare that to another individual or a standard for individuals who are of your age. Some common asthma triggers include pollen, smoke, mold, dust mites, chemicals, and it's important to note that the triggers can be different for every asthmatic, and what causes an attack or not is going to be different for every asthmatic. And so there's hundreds of triggers, but these are just three very common ones. To avoid these triggers, a lot of asthmatics use HEPA air filters just to purify the air and just make sure that they aren't breathing in more smoke or allergens than they have to be. Using masks or staying inside is also really important when there's smoke out or air pollution, and also making sure that your home is mold-free. Some short-term effects of asthma include just, wheezing, coughing, the difficulty breathing that we see, as well as an increase in respiratory infections, including bronchitis and asthma, as well as an increased rate of allergies. And allergies can really affect the overall stability of an asthma condition as well. Some long-term effects include lung scarring or just general lung tissue damage from infections that have an increased chance of happening when you have asthma, as well as maybe needing to be in the hospital if you have a low blood oxygen or having a really difficult time breathing and need to receive oxygen or specific medications to help reduce inflammation. To treat asthma, we all know about rescue inhalers that deliver albuterol, but besides that, there's a lot of different options for long-term inhalers that treat general inflammation throughout the body, as well as oral medications that can help reduce inflammation in the lungs, including immunosuppressants, which are becoming more commonly used. More asthmatics are also choosing to undergo immunotherapy to help reduce the inflammation that they have in their lungs from breathing in allergens, as well as severe asthmatics can choose to have biologic injections, which control proteins in the body that produce inflammation. A lot of asthmatics note that there's a cost barrier. A lot of the asthma medications, including long-term inhalers, are hundreds of dollars, as well as doctor's appointments and to the hospital. The cost, especially if they don't have good insurance in the US, can be quite large and is noted to be a barrier. Every age, race, gender is affected by asthma, but specifically in the US, we note that females are more likely to develop asthma than males, as well as those who are African American or Black community has a lot more prevalence of asthma than any other race within the United States. Mild asthma, symptoms present about once a week. In moderate asthma, we see that symptoms are present multiple times a week, and in severe asthma, symptoms are present multiple times a week. And so we use these three categories to classify how controlled someone's asthma is, and also just how severe it is, how much symptoms they have going on. So living with asthma, it's important for asthmatics to never leave the house without their inhaler. The rescue inhaler is also very important that they stay on their long-term medications to help reduce their overall asthma attacks. And then on the upper hand corner, you'll notice that this girl has an oxygen mask on her. That's actually a mask for a nebulizer, and a lot of asthmatics choose to use nebulizers in the home. Many children that have asthma, we're finding, actually do not continue to have asthma throughout adulthood. Although some do, many have symptoms that dissipate or reduce completely and they go on to live normal lives. Some do have asthma throughout their lives as well, though, and need to continue to take medications. We also have adult onset asthma. In adult onset asthma, adults over the age of 30 develop asthma after having no previous respiratory issues whatsoever. I want to note that this is, again, more common in women than in men for this adult onset asthma to occur. And in that case, they just take medications like a normal asthmatic to seek to gain control of it. Asthma and coronavirus. There's been a lot of back and forth with this, but in a lot of studies we're finding there is some increased severity of asthma, asthmatic, just because it is a respiratory disease. But overall, we're not seeing huge rates of increased mortality. I also want to address specifically in Utah, there's an issue with air pollution, and this is something we definitely need to talk about with asthma because asthmatics are so affected by air pollution, especially with the inversion here. There's just such high levels of asthma that the high levels of air pollution that asthmatics need to be aware of it all the time. They need to be aware of the air pollution level and stay inside on difficult days. If we look here at the total number of deaths, this is for previous year, in general, about 10 per million asthmatics die every year. And so 10 out of a million, it's not a huge rate, but there is some significant deaths coming from complications of asthma. And so I just want to remind you all to be aware of those around you who are living with asthma. It is a chronic disease and condition that they will continue to struggle with throughout their lives. And so be there and support them as they may experience difficulties breathing. And thank you all for listening in today.